Current developments, presidential directives, accurate and reliable updates straight from the palace. This is Daphne Oseña Paez, your Malacañang insider. To deliver universal health care and assure every Filipino the right to good quality medical care is a topmost priority of President Ferdinand R. Marcos Jr.'s administration. That is why the Department of Health is implementing innovative strategies for governance to meet the needs of our country. Dahil sa Bagong Pilipinas, bawat buhay ay mahalaga. We have with us today Department of Health Secretary Ted Herbosa. Hello, Secretary Ted. Thank you for joining us.
Thank you for inviting me and explaining the programs of the President in health.
Yes, I had to have you here because I saw in your Facebook update something about leptospirosis because of the recent floods brought by Karina and Habagat.
Yes, Karina and Habagat brought a state of calamity to the National Capital Region and several other regions. And a lot of floodwaters, heavy rains. And now, a couple of weeks later, we are having a surge of leptospirosis cases in our hospitals. And the number one hospital that actually sounded the alarm was the National Kidney and Transplant Institute. They posted a photo of their surge ward, which is the gym of the hospital, wherein they had 48. Actually, about 30-something was in the ward, but they had others in the hospital, which was already full. And these were mostly people that waded in the floods during Karina and Habagat, and they're now suffering from the severe effects of the disease called leptospirosis.
Okay. What were the symptoms and what were they being treated for in the kidney hospital?
Okay, so what happens in leptospirosis is when you wade in floodwaters and your skin has wounds or lesions, bacteria, the leptospirobacteria, jaundice, you're yellow in the eyes, and then they bring you to the hospital by this time because people think it's just the ordinary influenza after a rain. But when they get executive director of NKTI for additional health personnel.
Okay.
So this is what happened, and then from there we activated our Health Emergency Management Bureau, and then we started to monitor the other hospitals. And true enough, the other hospitals were also having a few cases of leptospirosis. So we got the bigger picture, then we started to do the allocation or patient navigation. So we posted a number. My spokesperson posted a number where people can call so that they wouldn't all go or funnel to the NKTI. Because the other hospital, the other big hospitals can also handle the dialysis. So now we're allocating it. The other one that has a lot of dialysis unit is, for your information, is the Jose N. Rodriguez Hospital in Tala. We use that as our COVID facility. That's why we have plenty of dialysis machine. Remember, part of the problem was hemoperfusion and all this need during COVID. So we upbuilt the capacity of that. So some of the overflow, we're bringing it there. I also, of course, asked my own hospital, Philippine General Hospital. They were also experiencing a surge. We call it a surge of cases. And so these things are the ones, the difficult thing about leptospirosis outbreak is they need critical care. So that's a high level of personnel to take care of you. Dialysis or dialysis to take care of the renal effects. And then, of course, antibiotics. So it's labor intensive. You need nurses, critical care, and everything.
Within days, you're gonna need dialysis?
Correct.
Days of exposure. So, kunyari, may flood, tapos nag-wading, nag-swimming ang mga tao.
Ang incubation period ng leptospirosis can be anywhere from 5 days to 30 days. So even a month after the flooding, you can still have the lepto. And it's not only swimming in the floodwaters.
Okay.
We've had cases of people na naglinis lang ng bahay nila. After the floods, the water subsides, so mud is left. The mud itself in their feet or in their wounds also is infected with the rodents, urine from the rats.
So ano ang suggestion nyo? Paano ma-avoid ang leptospirosis?
Well, number one, wag mag-swimming or mag-wade sa flood waters. Number one yan. And if in other countries, I hear that their public health departments warn people when there's a flood, that's sewage water. Sewage yan. Galing sa
Kanal.
madumi yan, galing sa kanal. So we shouldn't swim. Now, number two, if you are forced to wade in flood waters, na stranded ka, soap actually kills the... Soap, ordinary soap.
Pag by accident na expose ka sa flood waters, pwede kang mag-soap and water.
Soap and water, and if you have no wound, soap and water should be fine, and then drying up immediately after exposure.
Right.
But if you have wounds, it will be a decision of the doctor to give you antibiotics. So we give doxycycline or penicillin to actually give as a prophylactic for exposure, especially if you're high risk. So mayroong treatment, may prophylaxis. Meron ding paraan na we wear boots and rubber. So for the rescue people, remember the rescue people during the floods sa Bagat and Carina, we gave them actually, because they're going to work in the flood water, so we gave them prophylaxis anyway. So the workers, we already give them, but the ordinary people that get trapped in the floods, they're the ones that have to be divided into three kinds: low risk, medium risk, and high risk. And they're the ones we give antibiotics to.
Secretary Ted, nakakamatay ba ang leptospirosis?
Yes, I think we've had reported of at least 4 deaths already in the past few days alone. In NKTI alone, I don't know the other hospitals, because the other hospitals are also reporting. That's because you go into what we call septicemia, sepsis, and then into critical condition, and then they eventually go into shock and death. If the treatments are not done immediately, that's why their whole blood is poisoned from the toxin of the bacteria, and that's where the dialysis actually works, to cleanse out all these toxins out. And if that's not done, they eventually die. So very important, if you do get the symptoms, eventually you get to a place that can treat you, because some of those that die eventually has gotten to the hospital late in the stage. Like any illness, pag huli ka na nadala sa hospital, even if it's the best hospital, even if we have the dialysis, but if you got you at the point na it's hard to reverse the condition, they eventually die also. So today, very important, we sent out warnings to the public. Ano ang symptoms ng leptospirosis? Kung kayo ay naglumusong sa baha and you start to develop these symptoms, magpakonsulta ka agad sa doctor. We even published our phone numbers on the website so that you can call, and there'll be someone in what we call patient navigation that can answer your queries if you need to go immediately, or you can wait, or you go and where to go nearer to your house. So we don't go all to NKTI.
Ang mga bata ba susceptible?
Yes, children are also susceptible to getting leptospirosis.
Okay, so it's the rainy season now. There are other usual common illnesses associated with rain.
Yeah, we monitor wild. The mnemonics is wild, WILD.
Okay.
That's waterborne illnesses, that's diarrhea, and then anything you do when your hands are dirty or you get food and then contaminated water, so people get acute gastrointestinal illnesses. The second is influenza-like illnesses. Ito yung trangkaso, the ordinary trangkaso, because that's a respiratory virus. During the rainy season, people are in enclosed areas. Hindi sarado yung bintana, like COVID, you know, the poor ventilation. You're in a room of people, and then one is coughing. Hawa-hawa na yan. So we watch influenza. It's our influenza season. In the Northern Hemisphere, the influenza season is winter. In the Philippines, it's in the rainy season that we push that. That's why we get people to get the vaccination before the rainy season, especially our elderly. Kasi the elderly are the ones at risk for influenza because they can get pneumonia. The third is leptospirosis, the L, waterborne. I is influenza-like. L is leptospirosis. And the last one is our annual season, D for dengue.
Yeah, dreadful dengue.
Dengue actually is self-limiting, or you means you recover from it, but it's gotten kind of a bad light because so many people get infected with dengue. We've done very well with dengue. We treat it very well. The mortality or people that die from dengue are not as many, but you can still get serious dengue.
Do we have an outbreak or?
No, not yet. No? But we're having the numbers. Actually, we have about 100,000 a year, over 100,000 a year, and we're about getting to that number. But that will increase as the Burr months come. And we know there are times our hospitals get filled up with dengue cases. The key also is the nice thing now is we're able to diagnose dengue quicker. We have the NS1. It's a rapid test, just like the COVID test. So we're able to tell if their child has dengue or not.
Is it by blood or nose?
By blood. By blood.
Okay. Going back to the illnesses associated with calamities and disaster, other than warning people and the awareness programs, are there other programs that we could do to prevent this from happening? Maybe coordinate with the LGUs or schools or...
Well, number one, the schools. Definitely, I'll be going to Secretary Angara and start to talk to him about a convergence of health education or health literacy. It's very important to educate kids not to swim in floodwaters. I think that should be in the curriculum of our elementary. Or maybe our public officials should build public swimming pools, where water is chlorinated, so they don't wait for the flood season before they go swimming. So that's something we can actually inculcate in the minds of our kids. I keep saying swimming in floodwaters is like swimming in the Pozo Negro, in the sewer, because it's dirty water. All flood waters are dirty, and you get many diseases, not only lepto, skin diseases and other diseases from your eyes, from when you swallow the water there, that's very dirty. So very important education. We need to actually help our kids understand that swimming in flood waters are dirty. Number two, maybe we need some enforcement. Maybe local officials should start enforcing making people stay at home during floods. I see them there on television. You see, in fact, this season I actually called Teleradio because they were showing live kids swimming with salbabida and all. They're making tumbling in the water in flood waters. So I had to make an announcement that this is not safe. There, people can get leptospirosis. So I was the one who called media. So it's a proactive move. They were surprised. What did I want to announce? I just wanted to announce you're showing people live on the floodwaters, and kids were swimming. I said, kids should know. So officials can do enforcement. Another one is really control of the rodent population. Like any illness, like dengue, our program is to decrease the vector. The vector is the mosquito. So you remove the breeding places, you cover water, where the places where mosquito can breed. That's the same with the rodents. How do you decrease rodents? Solid waste management. So it's really pushing for very good solid management, especially before the rainy season and the floods. You see piles of garbage in every corner in most of the communities. And then when the flood waters come, all this garbage disappears. They're in the flood waters, and they all had rats that actually populate and eat them. So when solid waste management is poor, the rodent population numbers increase. When the rodent population numbers increase, leptospirosis cases will increase. So if we control the rodents, we should be able to control this as a public health endeavor. So maybe one of the things I'll plan to do is actually to go to the MMDA, Metro Manila Council, and really talk to them about this problem of lepto, because we cannot be doing the same thing and warning and not do something significant. Mataas talaga yung lepto. In fact, the rest of the world looks at us as a leptospirosis. Yes, Mumbai and Manila are the ones that have recorded world record numbers. Really? The highest is Mumbai after a flood, but you know what happens in Mumbai? The temples have rats. They don't kill the rats. But Manila, we can solve it because we can do rodent control. We should be able to control this. We're a city below sea level, so it's always flooded. But if we keep our solid waste management and rodent population low, I shouldn't be having this upsurge of leptospirosis cases a week after or 2 weeks after
My
floods.
goodness. Well, you mentioned the international reputation, and you just came back from the ASEAN Health Ministers Forum. How was that? And
this is my first health ministers meeting, and it's very nice that I meet all 10 of the health ministers of the different countries. We have many common things that we aspire for: universal health coverage, antimicrobial illness, antimicrobial resistance from bacteria, malnutrition, immunization. These are things we discuss there, and we share our good practices. So it's very nice to listen to what the other practices are. And it's also nice to learn that we have many things to offer to our ASEAN neighbors.
Like what?
In terms of health. I just discovered that the Minister of Health of Lao PDR, where it was held in Lao, learned his English in the Philippines. He learned it in Manila. Said, "You speak very good English. How do you know?" "Oh, I was in a program of the World Health Organization to teach English to Vietnamese, Cambodian, Lao, Korean." And they were 10 months here in the Philippines, taught by Ateneo University.
Nice.
Where else can you learn good English in Manila? Arneo. So he actually, I was wondering why he spoke very good English. So that's it. Then it came to my idea, why don't we have a bilateral? Then let's talk about how we can build your health system better by teaching more of your health workers English. Because if they learn English, the internet is the source of health information, and many courses online can be taken. So I think we have something to teach ASEAN by teaching the English as a language, especially Laos, Cambodia, Myanmar, all these countries.
Wow, so a shared English
rather than pirate our nurses. That's my option, because we can train your nurses rather than pirate our health nurses.
That's good.
We have a lot of teachers in Lao. That's what I discovered. Of the thousands that are there, 30% of the Filipinos there are teachers. Can you imagine that? So we have something to share to our ASEAN brothers, actually.
Interesting. Okay, we still have a lot to talk about, SecTed. Oh, I'm going to take a quick break. Up next, a discussion on access to healthcare services for all. We'll be right back.
Ang wikang Filipino ay tulay ng pagkakaunawaan at pagkakaisa. Patuloy sana natin itong pagyamanin, gamitin, at mahalin.
Welcome back. You're still watching Malacañang Insider with Secretary Ted Herbosa of the Department of Health. Secretary Ted, let's go back to the mandate of the Department of Health and the programs that you're doing. How is the DOH ensuring that our kababayans in the rural areas have access to healthcare services? This is in keeping with the Universal Healthcare
Correct.
Act.
In 2019, we actually passed the Universal Healthcare Act. Well, prior to that, we passed several laws that actually brought us to this, and I'll name some. One is the devolution of healthcare, which is the local government code, which allowed local officials to also run health systems. The second was the PhilHealth law, the National Health Insurance Act, which created a single insurance for all Filipinos. Although for a long time we had problems covering it. The third act that actually helped develop this was actually the sin tax law, the excise tax on tobacco and alcohol, and this increased our budget. There's a fourth one, which is actually the Universal Healthcare Law, which was passed in 2019. But unfortunately, because of COVID in 2020, we never got to implement it. It's only now in 2023, when we lifted the health emergency, that I'm tasked to actually make sure that the Universal Healthcare Law is implemented. So we're struggling with implementing it after experiencing all the gaps. And remember, the law was created before COVID. So it didn't predict many of the things that COVID exposed about the weaknesses of the health system. So it's all about having a strong health system for the Filipino people. And the next one that strengthened it is the train law. The train law was passed already in the administration of the president, because I saw that both the sin tax law and the train law added tremendous amounts of budget to the health system, which is good. We can implement universal healthcare law. My problem now is absorptive capacity. How do I use all these funds to make sure that healthcare is delivered to the people? So the first strategy here really is going to the most remote areas, the geographically isolated and disadvantaged areas. What happened, Daphne, to our health system was it was fragmented at 2 points. First, at the governor, when we had the devolution, the governors would run the hospitals, and the municipal mayors would run primary care or the health centers. And the DOH stopped at the region. And then we invested in the regional hospitals. We made the regional hospitals. But now, when we talk about universal health care, we talk about primary care. When a Filipino gets sick, they must go somewhere. They cannot go 100 kilometers away to the regional hospital. So my idea here was to build urgent care facilities in communities themselves. So this was announced by the president. Luckily, this was happily accepted by the communities. We built what were called urgent care, Bagong urgent care and ambulatory service centers, which is an extension of the hospitals in the community. So they coordinated with the barangay health workers that brought women that needed cancer screening, with women with people with diabetes, hypertension. So we brought the family and community medicine department into the community instead of waiting in the hospital for the people to come. And it was a big success. It was a blockbuster because what I realized was our poor still spend money to go 100 kilometers away to the hospital. But if it's in their community, it's either walking distance or a tricycle ride or a jeepney ride away. So it became accessible, and it's the same brand as the DOH hospitals. So immediately after we launched the first one in March 6, we now have 28 all over the country, and that was my initial goal. I only wanted to build 28 Bukas centers for the 28 million poorest. Of course, it's not enough, but I wanted to start. But because it was such a success, it even got to the SONA of the president, and he mentioned it. I was so happy that he mentioned it. Now I came from Congress, and they want to fund our Bukas centers
for every
well, as long as they're needed. So we're starting out in areas that are third class, fourth class, fifth class municipalities, those that are really poor. So making sure that healthcare is also there through our big hospitals. But we partner with the local, because in some areas, it's a partnership between the mayor or the governor to use a facility that has been built, but they cannot run it.
I was going to ask that. So you don't have to actually build the Bukas. It's already, you're using old buildings?
Yes. For example, the one in Santo Tomas was donated to us because the Santo Tomas mayor said, we can't run this. We don't have the budget to run a hospital. Then we said, okay, we will run it. So we ran the Bukas Center like a hospital without the beds. So it has most of the services, but it runs from 6 a.m. to 10 p.m. So at least you can sleep from 11 p.m. to 6 a.m. Let's go to the morning. So why it became a hit is that before, if you're a working person, by the time you end work and you want to bring your child to the hospital, the outpatient is closed. Outpatient service is closed. But the Bukas is open until 10 p.m. So you get home at 5 p.m., you see your child is sick, you bring them to the Bukas Center.
Bagay sa pangalan niya, Bukas.
Bukas siya, And then in the morning, 6 a.m. before you go to your 9 o'clock job, you can send your child or your mother there, and we're able to process them in an hour. Not like in a big hospital. It's so complicated, the patient gets lost, you don't know what's directing them where to go. You know, even me, as I enter the hospital, I get stressed already. But patients work in Bukas. I like the director of our JB Lingad. She said everyone is smiling in the Bukas. So it's more accommodating. Why? Because the cases you see are not hospitalizable, no beds. So it's like outpatient treatment. So they're able to process one person in an hour, in less than 2 hours.
And it decongests the bigger hospitals.
It really decongested the bigger hospital. The long queues in our emergency department and outpatient department really decreased. So each of the hospital directors were building one after the other. And then the congressman and the mayor started giving me land, and there's one that even built it in 2 months. He built one in Tubao, La Union. The congressman donated the land and then provided money. Of course, I provided the money to buy the equipment. But now it's running.
That's great.
So,
what about our regional health facilities, health centers, specialty ones?
So the next one that we patterned after the Bukas was a project of the First Lady and the President, which is the mobile primary clinic, because we can't build in every faraway place, but we can go there using the mobile primary care clinic. And the mobile clinic has all the things that we have in the Bukas. It has hematology, chemistry, X-ray, ultrasound, and its own generator set. and we put it in a smaller coaster, so it's not a big, huge bus, so it can enter the smaller roads.
Okay.
And it was really designed and thought of to bring to the most remote areas. And I saw this going with the First Lady in all this, and her projects, the Lab for All.
Right.
That so many people lining up to have laboratory tests. So that's the idea. I said the way to institutionalize this is build this laboratory and bring them to the community.
So who operates it? Who funds the operation?
So we gave the buses to the governor. So we bought 83 and we gave them to all the governors. It's been distributed to Luzon and Visayas, the videos, but we're distributing next to Mindanao. So by that time, we would have completed all 83. The governors received the facility, but our hospital will partner with them. We ask them to have a schedule to go around the province so that it can go to the most remote areas. So that's the order of the president, make the people feel healthcare. So we bring the mobile clinics. And then after that, I said, well, I'm not yet satisfied with just the mobile clinic. I want the DOH to go by Purok. So we have this last project, we call it Purok Kalusugan. And we launched the first one in Region 3 in Central Luzon. So it's a whole continuum of care.
Very integrated.
Well, basically, like in Canada. so I'm copying countries that have developed from cradle to grave healthcare systems. That's basically what UHC is. The UK National Health Service, the Canadian health system, Taiwan, Korea, Japan, all of these countries have developed healthcare systems for their citizens. That means the government takes care of you from cradle to grave. So the services will be available. So that's what I'm trying to do in the few thousand days that I'm left as Secretary of Health.
All the activities that you're doing, going house to house and generating a lot of data and information on patients that would normally not even go to hospitals, but you're going to their houses. What do you do with all that information?
So this is the other platform we're trying to use. We're trying to use digital health technology to improve efficiency of the healthcare system. So with the Purok Kalusugan, where we go to each house, find out the problems in a family, we can report that. The health worker can be holding a smartphone or a tablet, and this can all be submitted to a central command center. So we're building a command center for public health where I will know where all the malnourished kids are, where all the zero-dose children are, where all the childhood pregnancies are, where all the people with TB are. So we can map them, so we can actually have focused, efficiently address the health problem. So I'm using digital technology to make sure we don't waste any centavo. So we are able to treat them, and then also I'm hoping that with the eGov platform, people have an easier way to access healthcare. That means if they were tested positive for TB, where do I get my TB drugs? If I were tested for HIV, how do I get antiretrovirals? So I'm using all these other projects of government to be able to fix access. So that's access. And the second is making sure their health is maintained. So if you remember a few weeks back, a month back, I was being interviewed in a radio station. I said I wanted to change the name of the department to Department of Health and Wellness because now the trend is not just taking care of illness, but making sure people live long, well lives. So the idea is nutrition, good nutrition, health promotion, disease prevention, immunization. And then sports, exercise, movement. Making people active with movement, and that leads to longevity. In fact, I was talking with the health minister of Singapore. Yeah, we may have the longest life expectancy, but that's not really true. They're actually in a hospital bed attached to a ventilator. That's not the longevity they want.
Okay. You want good quality of life.
You want longevity. People in their senior years, but they are productive, creative,
and engaged
dance,
with each other,
with the community. So that's our goal. And I noticed some countries have changed their nomenclature to health, wellness, and longevity. Those are the common. Before it was health, welfare, and aging. But now, but I think this is really where we want to go. The best index of healthcare systems that work is that the life expectancy of your people is long. We're at 71. We're way off the first world countries with 85, 80 plus. So I'm hoping we will be able to live long. I'm hoping to live longer. I'm already out-aged my father who died of lung cancer. I stopped smoking.
Okay.
So because I said, oh, my dad died of lung cancer, I should stop smoking. I was a smoker. So I reached 66. He died at 60 from lung cancer. So there is a way to actually increase longevity.
Secretary Ted, and obviously one of your main mandates here is to really deliver the universal health care. But when you talk to the president, what are his other directives and his main interest, like in terms of health?
Okay.
Because this is very close to his heart. I mean.
Yes. So initially, when I came in, the focus was really the flagship programs. Of course, we will continue that. He was talking about legacy projects of bringing heart center, lung center, kidney center, the projects of his father to all over the Philippines. So we've continued that, and we did groundbreaking in Clark. We did groundbreaking for a cancer center beside lung center, and we're doing it in many places. In fact, in all the DOH hospitals, we built up heart centers and cancer centers and children's centers. The next step I explained to him was this primary care, these things I was doing. And when he was listening to my presentation in the cabinet, he immediately got it because he was a former governor.
Right.
He was a former governor of Ilocos, and he knew what I was talking about. So he completely agreed, and then he actually also included it in his SONA, the super health centers, making sure that people have access to healthcare. So I think we're mind-linked now in terms of what we want to do. The key is it's a big problem. We're an archipelago. There are some places where getting healthcare means crossing an island or riding a boat to the next island. And we need to fix that. I think some of the money should really go to just creating roads. For example, I remember there was a governor who talked to me. We were building him primary care facilities. He said, no, don't build me a primary care facility. I already built a hospital in the province, and the DPWH has built a road. So it now takes a tricycle 20 minutes to get to the hospital. So why will you build me a primary care facility? He was correct.
Okay.
So in essence, sometimes the infrastructure, the farm to market road is also the same road that the pregnant mother who has a complication uses to get to the hospital.
Right.
In other places, it would be a muddy road and no vehicle would go at night, and that's the time they're having complications. So the infrastructure, the access are actually parts of making sure. Telemedicine is another one that I think we're in MindLink. I talked to him about making sure that we have access to the doctors that are in the specialty hospitals, so that in the bukas, what we plan to do is also have clinics where you can just go on a camera and still talk to a specialist, because it will take time for these people in the community to schedule with the big hospital. But if I say once a week, can the specialist see the patients in the bukas? So an endocrinologist will see a diabetes patient that's hard to manage. A cardiologist can see a hypertensive patient that has some difficulty. So you have access to all of this. So it's really a systems approach.
Right.
Basically a systems approach and access. Of course, not everything will be ideal as I describe it, but at least it will be better from where it was prior to.
Already you've done a lot in a year?
Yes, a little over a year.
Over a year. So yeah, there's still a lot to talk about, a lot to look forward to, and I hope that you can come back in this Malacañang Insider and we can keep talking.
Sure, anytime. I think health is really, it's the third highest budget in the executive. I'm expected to do a lot. So I want to tell the people what we're doing with the money that Congress and Senate is giving us, and what the President's idea really of making sure that every Filipino feels healthcare. Sabi nga nila, bawat buhay mahalaga.
That's right. Well, thank you so much, Secretary Ted Herbosa. Accessible and quality health services for all Filipinos. As the nation's leader in health, hangarin ng Department of Health ang maipaabot sa bawat Pilipino ang mas pinalawak na serbisyong medikal sa buong bansa. We bring you the in-depth views of the latest issues and breaking news as it happens. Stay tuned for regular updates at the Palace. I'm Daphne Oseña Paez. Have a good day.